Hello, everybody, and welcome to another episode of Let's Chat About Aging in Your Community. We address local issues, but many of them really are national in scope in terms of the way that they address aging and, most importantly, aging with dignity in the community. Studies have shown that people want to live in their own homes as long as possible. And that's one of the things that CHATS is mandated to do, is to provide the kinds of supports and programs that allow older adults and their caregivers to be able to stay at home in their own homes and communities as long as possible. This podcast is brought to you by CHATS, Community and Home Assistance to Seniors, and I have the distinct pleasure of being the host and talking to a range of very interesting and dedicated people who all have some great ideas about how we truly can support older adults to age in their community and have that choice. So today I am really excited and delighted to welcome Dr. Patricia Spindel. I had the opportunity to do a webinar for Seniors for Social Action Ontario, which is an organization that was started by Trish. And so we felt that it was just fair game to reciprocate and ask her to be on our podcast as well. So I went through your resume and oh my goodness, Trish, you have a stellar resume and just arm's length of experience in academia, working as a policy analyst, and not just in the aging field, but also community living and social services. Um, uh, Really quite amazing to see the background that you bring to this organization. But from all of that, can you share with us, how did Seniors for Social Action get started?
Well, thank you, first of all. It's really an honor to be here, Christina, and also to talk with you because I know you've had a stellar career as well. Um, Actually, Seniors for Social Action Ontario started in 2020 when a number of us who had been involved in the deinstitutionalization initiative of the large facilities for people with developmental disabilities, who had always supported community inclusion and community living, saw the horrors unfolding in long-term care. And we just felt we couldn't sit by and do nothing. We felt we had to try to do something to promote the alternatives to these facilities because we knew they couldn't be fixed. We had a long history of knowing that you can't fix institutions. You can try to make them look prettier. You can try to do what they call emotion focused care. It doesn't matter. It's still an institution and people don't want to be there. And quite frankly, a lot of people don't want to work there either. If there were other alternative options, they would choose that. So we decided what we would do is we would put together policies and start advocating for the alternatives to these facilities, because what we found was when it came to care for the elderly, we were almost back in 1978. The focus was on institutions. All of the money was going to institutions. So little was coming your way in the way of other not-for-profits. We were just horrified. And so we said, you know what? We have to start putting the alternatives out there because this has been done for other groups of people. And the only people still institutionalized in this province are convicted felons and old people. And that's just not okay. So here we all are in our 70s, and we're back fighting the same battle, but this time for ourselves. So that's how it started. And it was 12 co-founders who co-founded Seniors for Social Action, and we incorporated as a not-for-profit social advocacy organization. Yeah.
Now, you mentioned that you actually started up in 2020. Is there any coincidence that that was also the start of the pandemic? And, we all went through that horror and trauma of seeing so many older people passing away in institutions.
That's exactly the reason why we got together. It was March of 2020 when we started to see the death toll rise. and we saw the conditions, and we saw that relatives and friends couldn't get in. And it was horrific. People were watching people die through windows. And it was just unimaginable. I think for people who, somehow missed all of that, it was one of the most horrific things we'd ever seen. And conditions in those institutions for people with developmental disabilities were pretty atrocious. So we had seen a lot, but we had never seen anything like this. And I happened to be advocating for and with the Orchard Villa families at the time. Orchard Villa had the highest death toll in the province, and it was located in Pickering. And I interviewed them in real time while all of this was going on, and actually wrote a small book about Orchard Villa so that people wouldn't be forgotten. Because this is what happens, as you know, Christina, people want to, sweep ugly or terrible memories under the rug. And I didn't want that to happen. So I actually wrote a book called A Perfect Storm, the story of Orchard Villa, and highlighted the people who had died there. Yeah.
Oh, wonderful.
Yeah.
So if you look back at what had to happen for the developmentally disabled community to move out of institutions into the community, what did it take, and why are we having a challenge with older adults?
Yeah, it's really interesting. A few things came together at the same time. The first thing that happened was younger parents who had children with developmental disabilities said, our children can learn. And we're not just going to put them in institutions. And at the time, the Ontario Association for Community Living, which is now Community Living Ontario, I was a policy analyst there and was charged with investigating conditions in institutions.
Mhm.
What had happened was that provincial organization was a tremendous advocate for deinstitutionalization. The families came together with the policy people, with the program people, with the nonprofits that existed. And we essentially formed a coalition to call for the deinstitutionalization of the facilities. And we put a lot of pressure on the government. At the same time, Wolf Wolfensberger wrote a book called Normalization that essentially said people have the right to live in the community and they have a right to be part of their communities. So all of that came together. Plus, there were some very good civil servants at the time, assistant deputy ministers in the Ministry of Community and Social Services, Dr. Dorothea Crittenden, who was the deputy minister, and a number of good ministers. And so they produced what was called the Welsh Report, which was a minister writing a report about the conditions. And also Walter Williston, who was a Queen's Counsel, who was asked also to write the first report, because two people had wandered away from one of the big institutions, and they had suffered horrible frostbite. And I believe one of the young men had died. And Pierre Burton at the same time did a major investigation and also exposed the conditions in the facility. So all those things combined, I think, actually pushed the deinstitutionalization movement forward. And of course, as we started organizing, it grew. It grew
Mhm.
because people knew how bad things were, and they started to demand change. And that's really what finally did it, is a huge group of people came together and said, this has to change.
Right.
Yeah.
So I've got a number of thoughts and questions in my mind, and the first one is why can't we get this same kind of movement happening in the older adult sector? What is it about older adults that
Mhm.
uh, there's just not enough advocates, or what's
Well, we've
the
asked ourselves the same question, actually, because we had really thought that the boomer generation would stand up for alternatives. We know older people don't want to be institutionalized. I mean, a huge percentage have said, no, we don't ever want to be institutionalized. I think there's a vision that's been lacking where people have not known what's possible. And so, no, John Lord, who is a co-founder of Seniors for Social Action, has written a book now saying this is what's possible, which is great. And I think the movement is just starting. And we now have over 1,700 members in Ontario who are quite keen to see things change. So we're now starting to educate people on how do you educate legislators to understand that things need to change. Because this government appears to believe that what you do with age is you institutionalize it. And of course, we know that that's not the way to go. That's not the way most modern societies have gone. But it's the way Ontario has gone. So Ontario has engaged in regressive policies instead of progressive policies. So I think what it's going to take is sheer persistence in getting the word out there that these things are possible. If we can house people with complex disabilities in group homes in the communities, 6-person group homes in neighborhoods, why can we not house older people in small homes in the community? Why can we not house older people in assisted living apartments with care built in, which I know your organization promotes, and I know
We
quite a
provide that
number.
service. Yeah.
Yeah, and I know a number of nonprofits do. I think we need to get nonprofits coming together with seniors organizations like ours, with the Ontario Caregiver Coalition, and we all need to speak with one voice and say, look, enough institutionalization, this finally has to happen. So I think that's what it will take is a coalition.
Yeah. So one of the other questions that comes to mind is that we are in the midst of a housing crisis.
Mhm.
The availability of deeply affordable housing is a challenge. Municipalities are trying to address that. The provincial government is trying to address that. If we were to move people into the community, where do we expect that the housing would come from for them?
Mhm. Well, I think this is a situation where private developers have land. I think what we have to start doing is convincing them that when they build housing, first of all, it needs to be accessible.
Mhm.
Because you know what? It's important for not just older people and people with disabilities, but young families who have kids.
Yes. Yeah.
Accessible housing is better for them too. So, first of all, it has to be accessible. Second of all, they need to create space in whatever buildings they're building. They need to be able to create space for clinical and social support services and programs, so that it's automatic where agencies in the community can actually set up shop there and all work together. So that, you have maybe family practice team, you might have a nonprofit, you might have a pharmacy, you might have, a blood laboratory, you might have all of those things in the same building so that you've got integrated services going into those buildings. What we've got now is it's such a mishmash. We have a big, maybe 18-story building. We have 20 PSWs from Ontario Health at Home running around that building, serving people, then getting in their cars and driving somewhere else. When in fact, we could have 3 PSWs serving everybody in that building, and that's where they work. They go there every day, and that's where they work, and they help people in their own apartments. So people can age in place. They have people they know providing the services. One of the big complaints we hear is there's this revolving door of PSWs so that you never know who you're going to get or if they're going to show up or what's going to happen.
Yeah.
This way, you've got that predictability, plus who's going to be providing the care. And nonprofits are perfectly set up to do exactly that kind of thing, to put integrated care, work in partnerships with other community groups and organizations and professions, put that care right into those buildings. And we must know where most of the hospital admissions are coming from right now. And I think they're coming from buildings with a high proportion of people who are older and who have disabilities. So that's where we need to put the services to prevent those hospitalizations in the first place. And I know CHATS especially understands that.
Yes, and we've been working very hard to look at ways to introduce services into NORC buildings, naturally occurring
Exactly.
retirement communities, which are not buildings that are not necessarily designed for seniors, but happen to
Right.
have
And
30% or more of the tenants or
right.
residents in the building who are older adults. And we're just working now with our partners at York Region and Queen's University to look at
Yes.
ways in which we can roll out a model to some buildings in our community. And starting with social programs, but then moving into how can we potentially bring in some clinical services as well. So
Exactly. Exactly.
people can get their flu shots or have their medications reviewed by a pharmacist and not have to leave their building to do so.
Yeah, because medication mix-ups are a big reason people end up in emerge.
Yes,
So
yeah,
if
yeah.
you can
I think
prevent that,
25% of emerge admissions are related to
exactly.
medication errors or
Right.
non-compliance.
And also mental health crises,
Yes.
a lot of people live in complete isolation, and your mind can run away with itself when you're living alone and you have sort of nobody to bounce thoughts or feelings off. And so NORCs help deal with that social isolation, which is really important, because loneliness can kill people, as we
Hmm.
know. So all of those things, are critically important. And I don't know why we haven't done it yet. I mean, I look back at and think Sweden, or not Sweden, Denmark stopped
Denmark.
building institutions in 1988. And they went with nonprofit assisted living, actually delivered by municipalities. And they went with up to 10 hours of home care a day. And so they just didn't have the need for institutions anymore. And that's basically what happens when you create the alternatives. People will choose those. They won't choose the institutions. So that's what we
Hmm.
really do need to do.
Yeah. You mentioned in our discussion earlier that there was a thought that the baby boomers would really lead a major sea change in this area. And I remember having a conversation with a CEO of a very large organization who said part of the challenge is that we don't want for ourselves what we want for our parents. In
Right.
other words, we want to have a place for our parents
Yeah,
to go, but heaven forbid that we should, be institutionalized ourselves.
exactly.
And it always that comment always stuck with me because it is something that we hear as an organization quite often is that, caregivers are so overwhelmed
Yeah,
and so challenged by trying to keep their loved ones at home that it gets to a point where they just want to have a place that they know that they're safe
yeah.
and they can go and visit, but they don't have that day-to-day burden.
And stress. Yeah. And I mean, what we've been saying to people is look, residential care does not mean an institution. I mean, you can
Yeah,
have
good point.
residential
Yeah.
care, you can have residential care in nonprofit community housing, in nonprofit seniors buildings, in small group homes and neighborhoods. I mean, when we look at people with dementia who are at very high risk of institutionalization, they do so much better in smaller homes where there's a smaller staff to resident ratio, where they can sit out the back and look at the birds, or take part in gardening or take part in just basic activities of daily living as they're able, and have that individualized and personal care. Plus, we also know that many people with dementia need trauma informed care. They need those kinds of interventions to help them calm their nervous systems, There's a tremendous interplay between PTSD and the onset of dementia that is completely being ignored. And so, what are we doing? We're re traumatizing people. We're putting them in locked behavioral units in institutions instead of small homes located in their own neighborhood where they can still go to the same parks, they can still go to the same cafes, they can still visit with neighbors and with their families. Instead of that, we traumatize them by putting them in an expensive, inhuman system. Over $300 a day to keep people in a locked facility? We could be staffing very richly in the community at over $300 per person per day, plus the construction costs, billions in construction costs to build these places. If that was redirected and community organizations could acquire homes and renovate them and staff them, we would have group homes all across this province already for older adults. And we should have that, but we don't, because that has not been the policy. And that's what needs to change.
Yeah.
We need to change the way we see people with dementia, just like we had to change the way we saw people with developmental disabilities. They're people first. We need to look at they're
Yeah.
people first.
Yes.
And so we need to be treating them like human beings, not like, convicted felons that we put in locked wards. That's not necessary. We used to do
Yeah.
that to people with mental illness too. We used to put them in locked facilities. Well, now most people are living in the community with support. We have high support group homes for people with, mental health challenges. So why can we not do that for people with dementia? It doesn't make any sense.
Yeah.
It's stigma. It's the stigma and the label that is causing this. And that's where the education needs to take place, is our elected officials need to start understanding that this is not the way you treat people.
Mm-hmm. Yeah.
Yeah.
So what is Seniors for Social Action Ontario doing about this? What's your
Well,
game plan?
the federal government, interestingly enough, has been interested. Tony Van Bynen, who is the MP up in York Region, I think she was your MPP, as a matter of fact, was very interested in. He was working with a committee that was looking at the possible expansion of NARCs, which is great. Tony's unfortunately has decided not to run again, but there are others who are picking up the cudgel who are in the government. So what we're doing is we're right now preparing a paper on NORCs that briefs MPs on what is required to actually expand them across Canada. So we will be launching an initiative asking our members to go out and talk to their MPs and start promoting the funding of NORCs. And by that, we're saying we need funding for service coordinators and community asset developers. That's what we need.
Yes.
And it's very inexpensive, but if you start working with older people in buildings to bring in those kinds of services and supports, then you start building a NORC with social support services, which is great. That will help people age in place. So we're doing that. We have written extensive policy papers. Thank goodness we have a deep bench of policy people in Seniors for Social Action. So we've been writing these policy papers that have been going out in regular mailings that have been educating our membership. But they've also been going to the Ontario government and saying, listen, you need to change direction. And in some cases, I think we've been successful. The horrific policy of forcing people into long-term care facilities from hospitals has been mitigated to some extent by Ontario Health introducing the Home First policy, where people now are supposed to have access to a higher degree of in-home support to help them leave hospital. So that's been a step forward. What we've found is that the Ontario Civil Service, because they're educated in these kinds of things, understand that the need is for the alternatives to the institutions, not for more institutions. Unfortunately, our elected officials have in the government have not understood that. And that's a big problem.
Yeah.
So trying to change that, what we've done is we've encouraged, there goes my phone, we've encouraged our members to try to convince their MPPs that this is the direction they need to go. So we're producing briefing notes and those kinds of things to help our members get to their MPPs and do that. The leadership, of course, can't do it alone. As you know, Christina, you can knock yourself out trying to do it alone, but you can't. You really do need the membership to go out there and talk to people as well. And that's essentially
absolutely. That's where the voting base is, right?
That's
And
where the voting base is,
yeah. And from a political perspective, that's what you pay attention is, are people going to vote with their feet on these issues?
Exactly.
But I go back to, the comment about we don't want for ourselves what we want for our parents. And it's something that we see quite frequently is, the call for, my mom or dad has been on a wait list for 2 years or somebody going into the hospital and ending up alternative level of care. They shouldn't be in the hospital, but for whatever reason, it's assumed they can't go back home, even with supports. So it's, waiting for that bed in a long-term care home. And I think that's the cycle that we need to break, right? Because that's where the pressure comes on the politicians.
But
Why,
it's the thinking that needs to be broken. Because you know what? Why would we want for our parents something we would never want for ourselves?
Exactly.
That just doesn't make any sense. And a lot of people have been down on baby boomers because we're shaking things up. But we're doing it for every generation that comes after us. If we win this, then every generation that comes after us benefits from our win. So the smartest thing that younger people could do would be to join us. We are an intergenerational organization. We're happy to work with allies. And, if we all stick together and all call for these alternatives, especially the residential alternatives if caregivers are burnt out, there's no reason on earth why we can't win this, but to just accept the status quo and say, well, we need more institutions in the short term. No, those are the institutions you're going to end up in. Because consider this, they're getting 30-year licenses. So people who are now in their late 40s and 50s are going to end up in those places. So this is why the cycle needs to be broken now, so that neither our generation nor the generations that come after us have to end up in these places. If we work together, we can accomplish a lot. And, we have worked with younger people in certain situations where we have shown them how they can lobby for something different than what's happening right now. For example, a lot of the problems that were happening in home care where people couldn't get enough home care, they're now starting to be resolved. We're starting to get more positive feedback about that. That's because of the pressure that we've all been putting on to change that. So if we can put pressure on now to change the residential component as well, which is get the developers to start creating space, get the government to start funding support services in those buildings where there's a high percentage of older adults, get people to start supporting horizontal NORCs because there are neighborhoods where there are high percentages of people. And we need to have a central neighborhood hub in those neighborhoods that provides support services to those neighborhoods as well. So it can be done. We just have to get our government to start funding it properly and move the funding, because they've got billions in funding sitting there, move it away from those heavy construction costs and start funding the community organizations to do what they do best, which is keep people at home. They cannot build their way out of this crisis, Christine. I think we both know that. You can't build your way out of a long-term care crisis. You're going to spend millions and millions on one long-term care facility housing 200 people, when for the same amount of money you could support those people in the community or have other residential options for them. We have data from the Ministry of Health saying that 69% of people currently in long-term care facilities have no significant disability. Let that sink in.
Yeah.
Those people could be easily cared for in the community, 69% who shouldn't even be there. And frankly, we don't think anybody should be there because we saw people with very complex disabilities being housed in the community, and we helped move them there. And this was
Mhm.
after years of abuse in institutions. So you can imagine their disabilities were exacerbated,
Mhm.
and they still flourished in the community
Yeah.
when they were allowed to come.
Yeah.
Yeah,
One of the quotes that I heard at it was a conference on aging, and one of the speakers referred to ageism as the last ism to be tackled,
that's right.
and that as long as we continue to see older adults as less than for some reason,
Yeah.
they'll then we'll, we won't have the political or public will to do something different.
You're absolutely right. And, I mean, that's what's driving social policy right now is ageism. The belief that all you have to do when people get old and frail is just put them away somewhere, just segregate them from the rest of society, and you're keeping them in and you're keeping society out and vice versa. And it just doesn't make any sense to do that. These are people who've contributed their whole lives to their
Mhm.
societies, to their families. Why would you throw them on the trash heap because they're getting old and frail? I mean, that just indicates a society that lacks compassion and that is also ageist. And the crazy thing is that everybody gets old. I mean, I look in the mirror and think, how did I get here? Where did the last 30 years go? And I mean, people who are in their 30s or 40s may not believe that now, but in another 10 years, they will. I mean, they'll start to look at themselves and realize, gee, I'm getting older, I'm changing. That's right. And you know what? And in 20 years from that, you could end up at risk of an institution. So now's the time. I mean, we all have to work together and change this
Mhm.
because this whole ageist policy is just, it's driving policy, it's driving programming in a lot of places, and it's driving attitudes, which is the worst of all, which leads people to say, what I want for my parents is not what I want for me. Well, wait a
Yeah.
minute. Your parents are every bit as human as you are, and they don't want to be there either.
Yeah.
So it's time to advocate and do something different because as you advocate for them, you're also
Also
advocating
add
for yourself.
yeah. Yeah.
Yeah, yeah,
Yeah.
yeah.
And I have to think too that with a housing challenge, that there could potentially be a way of repurposing those buildings.
Oh,
I don't know what happened when they moved,
absolutely.
the developmentally disabled community into homes. Like, what did they do with those buildings? I guess some of them are still boarded up because they
Some of them,
they
some of
were
them, yeah. Some were boarded up, but I think the OPP moved and went to one of them, which I thought was sort of
yeah.
amusing. And I thought, well, just be careful of the ghosts. When they closed the Lakeshore Psychiatric Hospital for people with mental health issues, Humber College moved in, repurposed it into classrooms. And I taught there, and a lot of the people used to come back and visit. And I used to invite them in, introduce them to the students. We all had coffee together. It was a great learning experience for the students to hear from people who had actually lived there and been subjected to some pretty horrible things while they lived there. And the students they were stunned, but it was such a good education for them. This is where we were, and this is where we are now. And so a lot of these people they're living in Parkdale, they're living in boarding homes, but they built their own support services. They have park and other kinds of recreation. They have um, jobs available through a number of psychiatric survivor run businesses. These things are like, they're all possible. We can keep people integrated in the community. And we have done it for every other group. So why have
Mhm.
we not done it for older people yet?
Yeah.
That becomes the question. And I think, with baby boomers, what I've noticed is that there are two kinds of baby boomers. There are the ones who aren't going to take it anymore, who are mad as hell, and they're going to stand up and
Yeah.
fight.
Yeah.
And then there's the others who've just kind of acquiesced, it's like they don't have the energy, they just don't have the fight. And a lot of them believe that it's not going to happen to them, that it'll happen to other people, but it won't happen to
Yeah.
them.
Yeah.
And you know what? None of us are under that illusion. I mean, none of those of us who are leaders in the community, none of them, I'm just hanging up, none of them are thinking they're going to end up in institutions, but none of the leaders of SSAO are under those illusions. We know we could end up in an institution, which, like, we're all one stroke, one fall, one car accident away. Really, people of any age, one car accident, one stroke, one fall away from potentially ending up with a disability and ending up in an institution. And the older you are, the more at risk you are. So, the leaders of the movement are not under any illusions. A lot of people are. And, denial is a huge problem. They just don't think it's going to happen to them. We
Hmm.
know it will. It's happened for over 80,000 people in this province. So, once you're over 85, you have a 1 in 3 chance of ending up in an institution. So if you live that long, yeah.
Yeah. And you mentioned um, prevention as well is so key.
Yes.
We know that people who are otherwise quite independent but have a fall and
Yeah.
break a hip or something, that the likelihood that they could end up in institutionalization is greater.
Yes.
So it just speaks to the importance of falls prevention,
Yep.
education, um, the kinds of things that could be done in these NORCs, right?
Yeah.
To have
Exactly.
help people with physical activities so that they build up their core and
That's right.
to prevent that hospitalization in the first place. And
Yeah. And
that's
yeah,
also an
yeah,
area where we just don't see enough attention or focus on the upstream. We're so focused on hospitals and
yeah,
lowering admissions and getting the um, alternative level of care people out of the hospital
yeah,
and somewhere else, to the detriment of investing in prevention in the first place.
that's exactly right. And nonprofits like CHATS are part of that prevention system as well. Because there are so many things that cause people to end up in hospital. But we know what some of the key things are. And
Hmm.
so those early interventions make all the difference in the
Yeah.
world. Having
Addressing the
them,
isolation you talked about,
yeah,
the loneliness, the falls,
yeah,
it's
and
medication. Yeah.
being able to just call a nurse practitioner and say, I'm experiencing these symptoms. What should I do? And a lot of times a nurse practitioner can over Zoom tell people what they need to be doing. And, they may be just a day away from a serious situation where they could end up in hospital, where the nurse practitioner could intervene and just say, no, no, you need to do this, not this. And
Yeah.
it'll make all the difference. And I think that's what older people have trouble with. They can't access their family doctors. Some family doctors are telling them, we'll give you an appointment in 2 weeks. Well, what good is that when people are in trouble now? So that's why those integrated supports and services are so important. But as you point out, so is diet, so is exercise,
Yeah.
so is learning falls prevention, so is having community connections, so that people miss you if you don't show up. I mean, I think that that's important. Like,
Yeah.
you could be lying in your hallway, and nobody would even know you're there.
Yeah.
It's the kind of thing where you have to have some connections in your neighborhood too, where people notice her car hasn't moved out of that driveway in 2 days. I better go over and check and see if it's
Yes.
okay.
Yeah.
Those kinds of things are really important.
Yeah.
And, we don't think about that either, the whole importance of community. And sadly, Christina, and you'll know this, I mean, because of the pandemic, we have become more detached from each other. And we shouldn't be. I mean, we need
Mm.
to make an effort to know each other, and to sort of know each other's habits and regularly see each other out in the community. And if we're not there, somebody needs to go check and see why you're not there. So those kinds of basic community connections too can keep
Yeah.
people out of hospital.
Yeah.
Yeah,
Trish, this has gone so fast.
I know.
It's been a great conversation. I know we could probably go on,
But
but
yes.
before we do wrap up, how can people get in touch with Seniors for Social Action Ontario, and how can we get more to join the brigade?
Well, I think if they go to Seniors for Social Action Ontario, just Google it, the website will come up. And on the website is our email. So they can just email us, and we have great volunteers who answer the emails. The email is seniorsactionontario@gmail.com. So people can just email us. That's the easiest and best way to get in touch with us. And I think they just need to think about their own aging and what do they want it to look like. And if they don't like the scenario now, then we would invite them to join us and get involved in talking to their local MPPs and their MPs, in getting out in the community, maybe getting the local library to organize a public meeting to talk about what the alternatives should be. I know you would go out to meetings like that
Mhm.
and present. And we have a YouTube channel. People can actually see all of the presentations we do that we have monthly.
Fantastic speakers that you've had,
Yeah,
yes.
and so people can go to the YouTube channel and just view any of the videos of the presentations we've already had to be able to educate themselves. Our website has articles, research articles, and editorials that people can read and just, bring themselves up to date on what is available. And then they need to get out there and push. They really need to get out there and push. And I'll tell you, I mean, you will know here in Durham region where I live, Seniors for Social Action has been very active. And we're working with the nonprofit Community Care Durham
Mhm.
and with the Durham Ontario Health Team and the local municipal councillors and the region. And we're pushing a PACE proposal here, which is an integrated care proposal. People can do that in any region. I mean, people need to be able to also work with your organization to help you get the funding that you need to be able to work with NORCs and expand programs and services in York Region as well. And there are many other regions like that where there are existing not-for-profits. People can work with them and start getting some things going and put some heat on
Yeah,
Ontario Health to fund them. Because that's the key. I mean, we
yeah.
need to put heat on Ontario Health to fund community-based programs to keep people out of institutions. And we need to get to our elected representatives and tell them that's what we want. Once the demand is there, there will be supply.
Thank you so much, and what
You're welcome.
a great comment to end on. So
Thank
I want to thank you all for joining us in yet another fantastic discussion about aging in your community. I hope you'll join us in the future. And in the meantime, take care, become an advocate. Think about, what do you want for yourself in the future, and what do we need to do for those older adults who are here today? Thank you very much. Thank you, Trish.
Thank you.